biomarkers definitely is something that people want to, you want to identify, is there a biological underpinning to what you're dealing with. And I already mentioned some of the neurodegenerative biomarkers that a lot of people are interested in, probably because this is relatively new technology. It's only been around for a few years. Simoa is what it's called, where it's extremely sensitive. It can detect like 1 molecule in a milliliter of fluid. And you can do it in CSF, you can do it in plasma, you can do it in serum. You have a lot of flexibility. So a lot of people are running the same assays looking at these markers. But there's also markers of vascular injury, which we think are important because, at least based on early pathology, it looks like there's something happening at the microvascular level, that there's blood-brain barrier breakdown, that products like fibrinogen can leak into the parenchyma, and that blood-brain barrier interruption might be part of the pathogenesis of what's happening neurologically with these patients. So markers like VEGF or ICAMs or some of these other vascular markers might be also of interest in some of these patients. And then, I think a lot of people are interested in the potential autoimmune story, like how many of these patients with post-acute sequelae are actually having an autoimmune process. Did they have a propensity or perhaps a subclinical autoimmune process prior to having COVID? Then it became clinically significant process. Did they develop a de novo autoimmune disorder having had COVID? So I think there's interest in identifying autoantibodies and the antigens that correlate with those autoantibodies. A lot of work's being done in that regard. And then also looking at standard autoantibodies that we already know about in patients that have rheumatologic disorders, for example. So I think it's going to be multi-pronged. Not all PASC patients are the same. Obviously, they have a spectrum of symptoms, and the underlying pathophysiology for different subsets of patients is likely to vary. So there probably is a subset that really has an autoimmune process. Their treatment is going to differ from people that have a different process happening.